I want to show you the top voted question on YouTube that was submitted on health care, and it comes from Ian McDonald of Michigan, who says he has a health problem. Watch it, sir.
Hi, I'm a student and I have a chronic heart condition. So for me, and those like me, the Democrats' health care reform, allowing us to stay on our parents' insurance longer, was a godsend. If you were elected, would you work, as is the stated position of your party, to repeal this reform? And if so, are we supposed to just sign up for 12 credit hours and pray really hard that our ailments don't prevent us from going to class?
When I hear this discussion, I think of my daughter Elizabeth, who's sitting on the front row, who suffers from juvenile diabetes. And I also am reminded that we're fundamentally approaching health care reform the wrong way. This $1 trillion bomb that Obamacare means to this country over 10 years is creating such uncertainty in the marketplace that businesses aren't willing to hire, they're not willing to deploy capital into the marketplace. It has gummed up our systems. In direct response, we need affordable insurance policies. We don't have affordable insurance policy today. We got one in the state of Utah, a stripped-down, bare-bones, catastrophic coverage policy that young people could finally afford. And then you can start whittling down the high percentage of the people who are uninsured in this country because they have an affordable policy.
Do you stand by your statement that the HPV vaccine is potentially dangerous? And if not, should you be more careful when you're talking about a public health issue?
Well, first, I didn't make that claim, nor did I make that statement. Immediately after the debate, a mother came up to me, and she was visibly shaken and heartbroken because of what her daughter had gone through. And so I only related what her story was. But here's the real issue. Governor Perry mandated a health care decision on all 12-year-old little girls in the state of Texas. And by that mandate, those girls had to have a shot for a sexually transmitted disease. That is not appropriate to be a decision that a governor makes. It's appropriate that parents make that decision in consultation with their doctor. But here's the even more important point, because Governor Perry made a decision where he gave parental rights to a big drug company. That big drug company gave him campaign contributions and hired his former chief of staff to lobby him to benefit the big drug company. That's what was wrong with that picture.
Governor Perry, obviously, 30 seconds to respond, sir.
Thank you. I got lobbied on this issue. I got lobbied by a 31-year-old young lady who had stage 4 cervical cancer. I spent a lot of time with her. She came by my office. She talked to me about this program. I've readily admitted that we should have had an opt-in in this program, but I don't know what part of opt-out most parents don't get. And the fact is, I erred on the side of life, and I will always err on the side of life as a governor, as the President of the United States.
Governor Perry, I now have a question for you. Texas has the most uninsured residents of any state in the country, 25%. In the last debate, you blamed it on restrictions imposed by the federal government, but we checked about that, sir. In fact, the feds treat Texas like they do all the other big states. On its own, Texas has imposed some of the toughest eligibility rules for Medicaid of any state in the country. In fact, you rank 49th in Medicaid coverage of low-income residents. So the question is, isn't Texas's uninsured problem because of decisions made by Texas?
Well, I disagree with your analysis there, because we've had a request in for the federal government so that we could have a Medicaid waiver for years. And the federal government has stopped us from having that Medicaid waiver, allowing the state of Texas, or for that matter, the other states that we're making reference to here, to have waivers, give them more options to be able to give the options. There's a menu of options that we could have, just like John Huntsman talked about. That is how we go forward with our health care. each state deciding how they're going to deliver that health care. Not one size fits all. And I think this whole concept of not allowing the states to come up with the best ideas about how to deliver health care in their state.
The other day, Governor Perry called Romney Care socialized medicine. He said it has failed in Western Europe and in Massachusetts, and he warns that Republicans should not nominate, his words, Obama light. How do you respond to Governor Perry?
I don't think he knows what he's talking about in that regard. Let me tell you this about our system in Massachusetts. 92% of our people were insured before we put our plan in place. Nothing's changed for them. The system is the same. They have private market-based insurance. We had 8% of our people that weren't insured. And so what we did is we said, let's find a way to get them insurance. Again, market-based, private insurance. We didn't come up with some new government insurance plan.